So welcome everyone. Sorry for the little bit of a snag, but we are getting everything going. So thank you for joining us for the ElderCare Advocacy webinar. We hope everyone is doing well and that everyone is staying safe. So yeah, we are Julie and Jenny.
No, it's fine.
Because I'm Rosemary is like half introduction care.
She's gonna just rush through it. So I walked away. So while you're getting in.
Okay, so the
that
I can't get to as of yet, but so to introduce this webinar, this is a webinar on elder care advocacy. So Jenny, if you could just go to the next slide. Perfect. Yeah, so as I said, this is a webinar on elder care advocacy presented by Rosemarie Ruggero. She will be presenting on what elder care advocacy is, what she does, and how she helps families. So we're going to let her explain everything that she does. So I'm just going to talk a little bit about PSS and what we do. So PSS, for anyone that isn't involved with us as of yet, if you would like to be, we are, so anyway, PSS was founded in 1962 and is an innovative multi-service agency whose mission is to strengthen the capacity of older New Yorkers, their families, and communities to thrive. So PSS Life University, which this webinar is part of, offers educational and other programs online at our 10 local centers and other locations, and are all designed to help older adults stay healthy, engaged, and connected. Okay. Next slide. So the program that Jenny and I work for is PSS Circle of Care. So that is the caregiver support program. So we provide free personalized support for those who are caring for someone who is frail, chronically ill, or has memory loss, so Alzheimer's, dementia, or any other type of memory loss. For our program, we don't ask for a official diagnosis, just that the person is experiencing symptoms of memory loss. So we also help families where a grandparent, oh, hold on, Jenny, if you could go back. Yeah, so we also assist families where a grandparent or a family member other than a parent is raising a grandchild. That is our grandparent family apartment building that we have in the Bronx. And is the first U.S. residence that was purposely built for grandparents raising grandchildren. So that is our kinship family caregiver.
The link where you could just the hyperlink, you should have been. So that's like what seems to have. I'm going to forward you here. So check this because I'm forwarding you now an email that I sent to Julie, who successfully registered.
Okay. Next, we have our Coming of Age program, which inspires people 50 and older to live with passion and purpose. Our 10 centers help older adults to stay healthy, engaged, and connected. And we, of course, welcome volunteers to who serve an important role in delivering our services as well. Okay, next slide. Jenny? Jenny? Okay. So, yeah, so that is a little bit more about us. So, all right, just some basics about how the webinar is going to go. If you have any questions, please type them in the question box. I do see that we have some here. Yes, she is on mute. Hi, Shaina. And we will get to the questions. We can either answer them live or we can respond to you we could either type the answer out. What we do ask is that any questions pertaining to PSS or Circle of Care be directed to Jenny or I, and any questions pertaining to ElderCare Advocacy be directed to Rosemarie. So that is how that will go. What you can also do is, if you would like to speak your question, you can ask to be unmuted, and we can do that as well. Okay, so if there are any questions right at the top, anything that is absolutely pressing, if not, then we should be able to get into this. We also would like to remind everyone to make sure that you participate in the 2020 census. These are very difficult times for everyone. Typically the census, the Census Bureau would have people coming around to knock on doors and, remind those of us who are not technologically savvy to, fill out the census in person. But since that cannot happen now, the census can be filled out in either online or via the telephone. If anyone has any questions about the census, definitely feel free to reach out to either Jenny or I, and we will gladly answer whatever questions you may have. And if we don't know the answer right away, we will certainly help you find it. Okay, so I think we should be about ready to go. Jenny, you're muted.
How about now? Am I good?
You're good.
All right, awesome. So thank you so much for that, Julie. And we actually are ready to go with our expert panelists. And today's discussion is with Rosemarie Ruggero from ElderCare Solution, Comprehensive ElderCare Solutions. And she is going to present to you on various topics of discussion in terms of her expertise and what her agency offers. So just to give a little heads up about to differentiate between PSS and ElderCare, if you have a question based on what she's presenting, you are more than welcome to enter your Q&A, enter your question into the Q&A box directed directly towards Rosemarie. And then if you have questions about Circle of Care, you can differentiate and direct that to either Julie and I, and we'll get to that at the end. So with that, I would like to introduce Rosemarie. Rosemarie, can you hear us? Okay. Hi, Rosemarie, can you hear us? Welcome.
I can hear you. Thank you.
All right, we can hear you as well. Welcome. Hi.
Yeah, thank you. We've had a few technical difficulties, so, but I do want to say that I'm honored to have been asked to present to this group who are professionals that work in the same field that I do. And after having only met me once. So, I promise not to disappoint, besides telling you about the hundreds of families that we helped and how we've done that and how we continue to do that, we have some brand new information to share with you about Medicaid changes that will be coming effective. They're right now scheduled for October 1, maybe with COVID. They may push it back, I'm not sure. But I am talking to you from my cell phone because I had a little problem with the computer, so I'm not seeing the slides, but luckily I have printed them out. I'm primarily a print person anyway, so we are a company that belongs to a professional national organization called Aging Life Care Professionals. And I'm not going to read from the slide because you can all see that. But all of us have been vetted by this organization. We're all professionals that work in different areas of healthcare. Some are nurses, some are social workers, and other like professionals. We've been certified by them after passing rigorous exams and so on. I myself have been in the field 40 years, having started as director of social work at a nursing home way back when. And when I left is when I started my practice. So just to, you know, as a introduction, as many of you know, the number of elderly are increasing tremendously, and this area of work is increasing relative to that growth. And now that the baby boomers are reaching an age where many are, some anyway, are becoming disabled and needing our help, they are going to be the largest group of elders that our country has ever experienced. And so there'll be lots of opportunities for you young folk that are in the field. Just to kind of give you an idea, a little bit of how we work, we have given you a case study, and it's Mrs. D. Of course, the names have been changed. She's 85. She has some Alzheimer's and other chronic conditions. She went to rehab for a fall, and when she finished her rehab, it was found that she still needed full-time care, or she will need it upon discharge home. We visited her at the facility. We did a evaluation with the daughter and explained the whole Medicaid process, what types of documents she would need. And we filed with something called Medicaid Immediate Need. I'm not sure how many people are familiar with that. We get information from the nursing home, and then we prepare an M11Q, which is sort of a medical form, but it also includes social information. And we submit that with the Medicaid application, and we've had, we had this case approved, and the daughter was very happy. She was given 24-hour care. But more recently, we've had 2 cases just in the past week that were both approved for Medicaid within a week, and services started within days afterwards. So it's an option that we use. Oh, not sure. Okay. It's an option that we use for those people, thank you, who are being discharged from a hospital or a nursing home. And it works very well. So basically the tools that we use are, next slide, I'm not sure, that's what I'm supposed to say, right, Jennifer? Care management, I can't see, it's on my phone.
No, are we on the right screen? Hi, Rosemarie, are we on the right the right
It
slide?
should be on the screen called Care Management with an Aging Life Care Professional. I'm going quick because I'm not sure how much
No,
time.
that's okay. I was on, can you see your slides on the screen?
You can go to another, nope, keep going.
Keep going beyond that. I'm sorry, guys.
Okay. Oh, I know.
There we go.
I skipped the results.
No, that's okay, because I hope everyone can see the slides now. We apologize for that snafu. Okay, so you're up and running with your, you could just read from your slides now, Rosemarie.
Okay, so basically the tools that we use is at the inception, we do a comprehensive evaluation for the most part in people's homes, nursing homes or hospitals. And I shouldn't look at my notes, I should just tell you what we do. And then depending on what services are needed, we coordinate those services. And I see, I'm sorry. I'm talking about, rather than the initial tools, I'm talking about when we do care management for a client that, because the family lives a distance away, or they're burdened with their own personal and family relationships, so they're not able to oversee their parents' care. So that's when we do concierge home care. And we oversee the care, we hire and fire aides. If the client needs to go to an emergency room in the middle of the night, we are there for doctor appointments, making sure that they're adhering to any medication regimen that the doctor ordered. And we maintain close communication with the family on a regular basis. So that's basically what we do when we have a care management case, which is very different from the cases that we apply for Medicaid for. And most people on Staten Island do have family to oversee their care, and they are only too happy to do so. So, because they visit their family on a regular basis anyway, except for currently. So then, next slide would be professionalism at its best. That's us. We're personable and passionate and very proactive. We anticipate issues that are forthcoming, and we work with families to try and mitigate against any negative impact. We are experts in the functional limitations imposed by diseases common to the elderly, which many of you know are dementia, stroke, arthritis, osteoporosis, and the others. But we also work with disabled adults who have multiple sclerosis, autism, cerebral palsy, so on and so forth. So we have worked with those who also have cognitive delays and have found group homes for them, etc. How we're different from other types of agencies is that we meet people in person to assess what our individual clients' needs. We meet with their family. We gather information regarding their functional, medical, social, emotional, cultural, and financial factors, limitations, how much family support's available, and we take all of that into consideration when we develop a care plan. We are definitely experts in the field of Medicaid rules and regulations and strategies. And what's also unique and very valuable is that because we belong to a national organization, and there also is a New York State chapter, and I'm on the board of this organization. So I have all of the resources available throughout the metropolitan area. If I need a registered nurse to look at a bed sore, I can have them come in. For bedbound patients that can't go to see their doctors and so on. Of course, again, we have to make exceptions for the present time. People aren't as accessible, but there are ways of getting around. We have all tried, we're all doing that now, whether it would be taking a picture. I, in fact, had my first telehealth appointment with the use of a camera, my phone. So no further details, but that's what we're dealing with right now. So,
So that's great. Rosemarie, that's awesome. I'm so excited to have you with us today. I just want to make sure we're on the same page. It's Jennifer. Can you hear me?
yes, I can.
Okay, so I'm sorry that there was a little lag in between being on the right slide. Are we good now where we're at? But you can see the mission?
I think we are on maybe a slide before or 2 slides before.
Okay, so you, with the professionalism and care, so you went
That's
over.
the one.
You want me to stay here?
Stay there for a minute, yes.
All right, and then
I'm
when
a
you.
fast talker.
No, that's fine. You're doing great. We still have a whole nother half hour. Hopefully some people even join in midway, right? So you're good. So go ahead with that slide. And then what you'll say is when you're ready to move on, just tell me next slide and I'm right here for you.
Okay.
Okay.
So, you know, it's important that every case is individualized. And, you know, we've had people, in order to get services, they needed someone that spoke another language. We were able to find those types of people, get them hired under the CDPAP program. I'm assuming many of you know about that program where Medicaid allows you to hire your own person as long as they're willing to work on the books. So we're able to do that. You know, because of the vast network that I have colleagues that provide different kinds of services, and when needed, I can pull them in. So that's very valuable to us. So the other way that we differ from other agencies is that we're not bound by any parameters. We don't, you know, other than our mission, which is to advance the physical and emotional well-being of the elderly, which I know we share with all of you, and bring peace of mind to their family or their advisors. Those would be the referral sources through expert advice and oversight. We also have a strict code of ethics and standards of practice that is set by the Aging Life Care Association. For instance, not accepting kickbacks or being the healthcare proxy for a client that's paying us. That could be a little conflict of interest. So next slide, Jennifer. So I don't know, are we gonna wait till the end for questions, Jennifer?
Yeah, let's do that. Let's go ahead with this because I don't see any coming in at the Q&A box that I have access to. So let's go ahead and finish that, you know, finish the presentation itself, and then you can certainly say, yeah, and when you're ready to receive questions, then you can say that, and then we'll check the box, Q&A box.
Okay. All right, so I want to tell you all about the Medicaid changes that are coming up due October 1st. That would be the next to last, that's right, Jen. So they met, the Medicaid Redesign team passed this just about the beginning of March. And the main change and the most drastic change is going to require people who are applying for Medicaid home care to provide 2.5 years of financial information. So as you probably know, there's a 5-year look back for nursing home Medicaid. Now, rather than just 1 month, there's a 30-month look back for community Medicaid. So what we don't know yet, as some of you may know, when you've transferred assets and you're applying for nursing home Medicaid, they look back 5 years. They look at any transfers. Let's say a grandmother decided to pay for her granddaughter's wedding 2 years ago. Let's say the wedding cost $30,000. Right now, Medicaid has a penalty formula where they divide the average cost of a nursing home into the amount of funds that were transferred within the past 5 years. So just as an example, let's just use that case. So, and I'm going to make the math easy because math is not my thing. I'm a social worker. Let's say the penalty formula is $10,000. That means you divide 10,000 into 30,000, which was the cost of the wedding 2.5 years ago. That would mean that the client in the nursing home would have to private pay for 3 months, 10 into 30,000, 3 months. She's ineligible for nursing home Medicaid. She doesn't have the money. Her granddaughter has to somehow get that money back to her. Now, the same is going to be true for community Medicaid, but the difference, this is why it's really draconian, because at least the person is already in a nursing home getting care. When somebody's being discharged from a nursing home or hospital and they're less than what they used to be, they need care right away, and they're not going to get care right away until they pay privately for whatever that penalty period is. We don't know if they're going to use, the real number is 12,000 something right now that they use for nursing home Medicaid. We don't know if they're going to use that formula or they're going to make it lower. We don't know. We don't know whether they're going to allow clients to pay their neighbor privately for whatever the length of the penalty period is, or are they going to have to pay Elixir or a Medicaid vendor agency for the period of time that they're denied Medicaid. So there's a lot of confusion, ambiguity about these changes, but that is the most important change. And I feel that there's a lot of people that are going to be disqualified and not sure how they're going to be able to pay for their own care if the money is no longer available. One thing they didn't change, thankfully, they didn't take away spousal refusal. What they did do was lower the amount that the spouse, the well spouse in the community is allowed to retain, which now with the new change will be down to about 78 rather than 128. So, you know, that's significant for the well spouse. And there'll be some other changes in terms of how they evaluate people. It's already pretty strict now, and we fear that it will become more strict and more narrow. Not sure. They're going to have all evaluations reviewed by some Medicaid physician who's in some ivory tower somewhere, who does not see clients, doesn't know their limitations, and they're going to be the ones that are going to have to sign off, I think, especially if someone was approved for high hours. So those are some of the changes. There's more, but Those are the more significant ones. And I think they're going to make some changes with CDPAP as well, and narrow that in whatever way that they can. You know, I think that company called Freedom Care didn't help.
Yeah. So Rosemarie, thank you so much. That's why we were so excited to have you, because you're an insider with this kind of information that we get a lot of questions about, but we're not Medicaid experts. So that's why we tag in guys like you, professionals like you, to help people navigate those choppy waters. And yeah, this is kind of it's unsettling news that now there's more of a look back, because that means, is that going to be a barrier to service quick in a fast amount of time for people? Yeah. So just to double back around, because maybe it was some folks maybe are just joining us. So the benefits of being with working with an agency like yours is they get that really hands-on, direct, one-on-one guidance from a professional who can help them go through all of this. So that's why ElderCare Advocacy is awesome to have on your side, so that you can have an expert who knows how to maybe not be on hold with somebody and have hit 1, 2, and 3. They can go directly to, the person that's going to make some kind of decision or make sure the papers are reviewed. So that's the importance of having a social worker like Rosemarie and her staff on your side with navigating these choppy waters of Medicaid. So that is awesome. So I'm looking at the Q&A box. Rosemarie, are we there yet? Is that okay for you?
I don't see it. You'll have to tell me. I was
Yeah,
only able
that's
to
what.
get on my
Yeah,
phone.
no, that's how it's gonna go. I'm gonna it's good that you guys can't see the box, because it keeps it anonymous. I can see the questions, so what I'm gonna do is read them off to you, and then you're gonna
Okay.
respond. Okay. Alrighty. So our first question is, if someone was already approved, will that be affected or grandfathered in?
They'll be grandfathered in for sure.
Okay.
Yes.
Sounds
Yep.
like a
Even when they do research, it'll be grandfathered in.
All right, that sounds like a pretty cut and dry answer. So that is, again, the only question we have so far in the box. And I hope that was thorough. And yeah, so you can talk about two other, like I know that you mentioned this is important too, because especially now, because it's hard for folks to get out. I know that you mentioned you guys are able to do home visits. Is that still? Yeah.
Yeah, we've done, of course, as a matter of course, we would do home visits, but because of the situation,
right.
I know Linda and I went on Linda Pereno, who luckily joined us a few months ago, but we went on a home visit, and we didn't have all the details of what this particular man was suffering from, but when we found out it was a lung disease, we were concerned about whether were putting him in jeopardy, because this was pre-mask, pre-glove.
Right.
And then about a week later, it's kind of when everything just bust open.
We're in the same boat. Absolutely. We're kind of in the same boat. We're not able to do home visits, but that's why the virtual and telehealth services are really vital right now. So if you just want to touch base, I'll just give you an opportunity to let folks know how they can access you guys now. So would it be like a simple phone call and then an intake and all of, your procedure with getting enrolled with you guys?
Yes, there's someone in the office every day. We're working individually now to protect each other.
Yeah.
And if someone who's not in the office needs to make a follow-up call, they're given an email or a text right away.
Okay.
We're all very, very busy. And it is
imagine.
more difficult working remotely because we're a paper-intensive company. And but we're doing good. I think, getting 2 immediate need cases approved within a week. By the way, the people at the local CASA office love us because we've been keeping them employed.
Yeah, absolutely. So we have another question, Rosemarie. So that segues beautifully into this person's question. So we have Noreen inquiring about how often recerts are done and who does the recertification. Like for
recerts are generally done once a year for clients receiving Medicaid. At times, we've seen for people that are getting 24-hour care, they require them twice a year. Our company does the research because we have found that at times that when MLTCs do them, they're not submitting the required information, especially if there are pool trusts involved. They don't have access to obtain documents from the pool trust because they didn't apply for the pool trust. We apply for pool trusts for our clients, and we list ourselves as contacts. So we're able to get confidential information to supplement the recertification so the pool trust is approved. So we do them.
Okay, so that, I hope that answers the question presented about research. Again, just to give you guys, don't feel like if there's something that you missed here, that you will have a chance to follow up with either ElderCare Advocacy or PSS Circle of Care. You guys are more than welcome to call in and inquire about something that was maybe unclear. Certainly with Circle of Care, I'm sorry, Rosemarie, I don't want to put you guys on the spot with that, but I just wanted to just get that, get that understood, that that if there was something that, comes up an afterthought, that you are more than welcome to reach out to either Julie or myself from Circle of Care, and we can circle back around to get you the answer. So we do have another question. Rosemarie, you can hear me, right? I'm sorry. Just got to keep checking on that.
Go ahead.
Okay. All righty. So another question is, what was the issue with Freedom Care?
Oh, well, Freedom Care was, I hope I'm not offending anyone, but Freedom Care was, they had great marketing people, and they were on a lot of radio stations and TV commercials, and Freedom Care was a euphemism for the CDPAP program. And so this particular company, I don't know, I think they did very well. Because of their advertising. I would have people call us and say, can we apply for Freedom Care for them? And so they did a great marketing job, but I have a feeling that maybe, and this is just anecdotal, it's just my opinion. It's not based on any fact, but I just wonder, why did they go after the CDPAP program? And I think they're going to reduce the funding for that program, and it's going to be more difficult for families to get. I mean, I think that the CDPAP was intended to allow people to keep aides that they had had for years, to continue to care for them. And I think what happened is that some children who lived with their parents their whole lives were now suddenly getting paid. I personally don't think that children should be, if you can avoid it, providing intimate care. There needs to be some boundaries, and it's not that I myself was not in that position. There was a point, my dad was living with me, where some circumstances arose, and you have to do what you have to do. But I think as a matter of course, to do that 7 days a week, 24 hours a day, is it kind of blurs the lines between who's the parent, who's the child. And
it's an extreme expectation on the caregiver's part, and if they're family, it's a little tough. Absolutely. So we have another question. So if someone, this actually piggyback on if someone was already in, are they grandfathered in? How long, I think this person's question is, if I understand correctly, is how long is the look back for a recertification? I'm sorry if you already answered that, but that just came in.
I didn't. It's a year.
Okay.
It's a year, so that during that year, we instruct our clients, you never deposit any funds in your relative's account. The only thing that goes in there is their income, and you only use their income for legitimate needs.
Right.
So, yeah, some people do some crazy things over the course of the year, and they think that it won't be seen, but it will be.
Yeah, so that's a big one. Okay, so that was, let me just double check, make sure that we got everybody. Okay, so we have another question. Do you charge for your case management services on a monthly basis? I don't think you guys covered that. Is there a fee? And if
Yes,
so,
we're a private company. We
Right.
don't have HRA or VNS or anybody else paying us. So yes, we
Okay.
charge for our services,
and that
and
would be
it
something,
depends
yeah,
on what the service is. Yes.
right. So that would be based on after assessment, what the case is going to need exactly. And you kind of, is it fee for service where if they already come to you with an application complete, it's just going to be advocacy and kind of, being their frontline man, or is it going to be more in depth? So it's basically sounds like case by case.
We always complete the application
Okay.
if we're talking about Medicaid. And I have to say that the application, if you just take it literally, can be answered by a fourth grader.
Right.
But what the fourth grader or family member doesn't know, that the answers given could affect approval, because the questions are reflective of
Right.
Medicaid rules and regulations, and the parents or whoever, children, filling them out don't know the Medicaid rules and regulations. And I'll give you an example, a quick one. I had a daughter call me a couple of weeks ago. We spent some time on the phone because sometimes people don't know what is wrong. So we have to play detective, and I hope Danielle is listening, because we often have to play detective because families don't exactly sometimes understand the implications of everything.
Right.
And so with this family member, she thought that her mother was being denied Medicaid because she said that she charges her rent and that Medicaid added the amount of the rent to her income, and then it meant that she had a surplus and she needed a pool trust. And really what it was, her mother was a US citizen, but from Iran. And when she lived in Iran, she worked as a teacher. She retired as a teacher. And before the US sanctions against Iran, during the Trump administration, when he changed everything, her mother was getting a pension for $250, believe it or not. But then once the US sanctions against Iran were implemented, she was no longer getting a pension. And who knows in the foreseeable future when she will get her pension. But when she filled out the Medicaid application, she said that her mother was getting a $250 pension. And then she said what they were charging her. Anyway, I said, your mother is not getting a pension.
Right.
She's entitled to a pension,
Right.
but she's not getting a pension. And we need to show them the legislative language that
Right.
states the sanctions. And then that's what we need to show them.
That's
So
one.
it's mistakes like that.
Right. So Rosemarie, I'm going to
family
stop you right there. That's perfect, because that's exactly why it's important to know that you should always engage with a professional who can help you, again, navigate those choppy waters, because as insiders, you know how to present the application in a way that's going to ensure approval. So that's
Right.
why, so again, yes, so PSS Circle of Care is a New York City Department of Health funded program. So our services are free, but when you enlist a professional for private pay, there's actually so much benefits, because they can really, again, help you ensure that you're not going to waste your time submitting applications and entering wrong information. So thank you so much, Rosemarie. That's exactly why it's vital to have somebody like Rosemarie and her staff on your side when trying to maximize your benefits and get, exactly what you're going to need as a caregiver. And so, Rosemarie, again, you work with people who themselves are disabled, or is it always with the caregiver?
Oh, sometimes I work directly with
Okay.
the disabled person, absolutely. Especially
Okay.
if they're younger, or I may
Yeah.
work with the spouse.
Okay.
Mhm.
That's another differentiation between ElderCare Advocacy and PSS. PSS is strictly caregiver program, the Circle of Care in Staten Island, but Rosemarie's agency can help the person who themselves is needing the care. So that's good to distinguish. Yeah. I don't see any, oh, we just got a question. I spoke too soon. Okay, so the question that just came in, Rosemarie, is do you have any particular adult daycare programs that you refer clients to? So do you make referrals to like social adult day programs or stuff like that?
Yeah, so if during our consultation, the client or their family indicates that their family member would benefit from social daycare, then we're going to use an MLTC, for instance, that provides social day, well, that would be more medical daycare, right?
Well, medical model, social model, I think that the question, yeah. So whatever
Yeah,
they,
you know,
yeah.
I refer, yeah, some,
Okay,
yeah, we use daycare
yeah.
depending on what the needs are. And there are some that are private, which are very good. And there are some that are connected to nursing homes and so on and so forth. Yeah.
I thank you for that. I liked what you said, you mentioned before earlier in your presentation about being plugged in the tri-state area, because we get a lot of out of area, what we call it, you know, identify as out of area calls with a loved one who lives in Staten Island, but the caregivers, you know, in North Carolina or even sometimes abroad, you know, international. And it's just nice that, you know, we can link them with services, you know, outside of, you know, our insulated world of each borough or, you know, so that's good. So
I
you
have
make
even colleagues in Toronto, California. If anybody has family anywhere, we can make a referral like that. Yeah.
That's great. Excellent. Excellent. Okay. So that's good. So we do have another question. Let me get this. Are there certain, so this question is, are there certain MLTCs that allow the caregiver to go with the client to the social adult day program? So I guess she's asking basically, can the aide go? Like, do you know of an agency that allows the aide to attend the social adult day program with the client? Well, with the care receiver.
Some of them do. I couldn't say specifically which ones. I think Linda might be Linda, you hear that question?
I'm not sure. Linda, are you muted? I think she might be muted. Let me just, but that would be, again, so we have 10 minutes left in this, but again, that would be to encourage everyone listening. Questions, I'm sorry if the questions aren't getting answered right now, but that would be a follow-up call with the staff,
Okay.
you know, yeah, stuff like that. But so from your knowledge, basically to try to do our best to answer this question is, it depends on the facility and their policy, right?
Yes.
Yeah, so that's pretty much where the, I hope that answers your question for that one. Let me see, another one just came in.
Yeah, that was Linda. She said she can hear, but I wonder if she could answer.
Yeah, Linda, okay, so Linda's there. Let's see if we can unmute her, because give her a chance to answer this question. Linda, I'm looking for you. Hold on. All right, so I don't think that we're going to be able to unmute. Linda is a case manager with Rosemarie, guys. She's somebody that most likely, if you were to call, she could follow up with you and answer questions like that.
Absolutely.
So, but you're certainly welcome to continue typing questions in the little Q&A box. You guys are good at that, I see. And okay, so like I said, we have we're approaching 3 o'clock, and we would like to definitely thank Rosemarie and her wonderful expertise knowledge, and we're so happy that she did this. And I guess with that, I'll give you some time, Rosemarie, to, you know, any afterthoughts, any other things that you'd like people to know about how you guys operate and the services you provide.
Sure. I'd welcome anybody that's listening to the webinar. If you have a client with a question about whether we can help them, please give us a call. We're available. We have a comprehensive view towards different situations. We can usually help depending upon whether people will allow us to help them. That's always the biggest.
Yeah, that's the bad. Sometimes that's the biggest barrier. So I think that just to confirm, I have on the screen everybody's contact information. Well, the names and the titles of your staff and your address. Can everyone see that? Is that the screen that you see right now, Rosemarie?
Yeah, that's the screen. Yep,
Yeah.
1946 Victory.
Right, so the 447-3824 number would be the one to call, to
Absolutely.
receive a call back, to do the, I guess like an initial consultation kind of thing, and then you go from there?
Yes, and just to be clear, we are based on Staten Island, but we do work in the other boroughs.
Okay.
We have lots of clients in Brooklyn, especially.
Yes. Good to know, good to know. So like I said, we had, I see the participants. Let me just double check the Q&A box. I don't see any refreshed questions. So, but I apologize, guys, if I'm just not seeing it in the Q&A box. But again, you're more than welcome to call and follow up and receive some more information. And that slide is giving you, I'll just leave that up so you guys can write down the number. And then, yeah. And then for PSS, I'd like to just use this opportunity as well to just, anybody that joined later after our information was presented, PSS is a caregiver support program, and we do stuff like this. We provide free education and support services to caregivers. So linking you with other experts who can take your case further and advocate for you further. We offer respite services, so we have financial assistance to pay for an aide to go into the home on a temporary and limited basis, but it is there. And the number to reach a PSS care consultant is 1-866-665-1713. And again, similar to what you would be doing with ElderCare Advocacy, you do a short intake, answer some basic questions, and you get a follow-up from a consultant who will call and see how we can help. And I think with that, I will check the box again. I'm not seeing any updated questions, but okay. Again, I'll turn it back over to you, Rosemarie, if there were any afterthoughts, but that was really, really great.
Like I said, I'm really honored. You only met me once, and here I am.
You made a great impression.
I hope that I've provided some information that will be helpful to you and all of your work with your clients. I was very impressed by the people that were at the meeting a couple of months ago. And I'm so happy to be a part of it, and we will definitely continue to be a part of it because I want to learn from all of you too.
Yeah, this is just the beginning of our partnership with ElderCare Advocacy, Rosemarie. And like I said, I'm glad that we found you as well. And right now we have just a big thank you in the question box. So there was a thank you. So we have 5 more minutes. Zoom is not evicting us yet, so we have some more time. So if there is anybody else who's a little gun shy, you still have a question, you have 5 minutes to put it into the Q&A box, and Rosemarie is still with us. So, yeah.
Oh, hold on. I just want to answer this one. Will the webinar be available for you to view again? Yes, the webinar is being recorded, and you will be able to share the webinar. All of PSS's webinars are available to be seen. If you go to pssusa.org, you can go to, I believe it is the resources tab, and then from there, you go down to, hold on, if I'm able to do it. Once you go to the resources tab, it should be right there, and you can access all of our past webinars, and this will be uploaded there. I'm not entirely sure when it will be uploaded, but relatively soon. And once it is, it will be available to view as many times as you would like.
Thank you, Julie. I didn't even see that one. See, that's why we need both of us on the job. Oh, we just got another one. Oh.
3 questions.
Yeah, this is Linda. So Linda, she's the case manager with Rosemarie's agency, ElderCare Advocacy. She's asking, oh, she's actually giving us a compliment that we're saying that we provide good resources. Thank you, Lynn.
Thank you.
So that is, I guess that's a good time to say that, yes, PSS, for all of our people maybe that are joining us that know what we do and have been with us in person at our live events, unfortunately, just like with what Rosemary was saying about home visits, we're not able to do that anymore because we had a lot of our stuff at assisted living facilities and the libraries, and we can't access those spaces. But we are able to do virtual events, which we're getting up and running with, and we'll be scheduling a lot more. So pat yourselves on the back for joining us, because this makes us all look really good that we can pull this off and keep it going so that you guys don't have any gaps in services, and we can still be here for you because we are still working, and we're able to work remotely. So that was good news to hear that Rosemarie is, her agency is able to do the same thing, so nobody falls through the cracks, because that's what could happen, right, at a time like this?
Yeah, for sure.
Yeah. Yeah. So with that, I would like to say that we have pulled it off, Rosemary. High five. So we got, you know, it was a little touch and go there, but we did it. And again, anybody is welcome to follow up with us for any questions that come up after we end the session here, which we are going to do. And with that, I would like to say thank you, and everybody stay safe, stay home, and give us a call if you need some services.
Yes, thank you, everyone. Thank you for participating. Again, same as Jenny said, if you need anything, please feel free to give us a call. We're here to assist you in any way. And yeah, please feel free to watch any of our other webinars that we have up on the website. There is a whole wealth of information on there, so many different topics to look at and learn about. And yeah, just again, Rosemarie, thank you so much. This was wonderful.
Thank
Okay,
you.
guys. Thank you,
All
guys.
right.
Have a good day. Hopefully, if you get some fresh air, if it's safe, enjoy that. And thanks again.
Okay.
Bye-bye.
Bye-bye.
Thank you.